Ebony, what did you make of the comments today from the Premier and Health Minister?
Well, I think you're right. They're kind of casting ahead to a bit further than we thought we would be. It sounded more like phase 2 from the Prime Minister's plan, but we're not there yet with the vaccinations, obviously. And I think the community in Australia is used to not having many cases now, and that's going to be the huge difficulty for Gladys Berejiklian and the government there. If they try and push out ahead of where the community is, the community feels quite safe at the moment with the low cases, and I think this is essentially going to be a bigger problem for the Prime Minister, because people are starting to see now that the problems in quarantine, the lack of capacity, the snail's pace of the rollout, people are starting to link that directly to these, outbreaks.
Yeah, so that conversation, though, around living with COVID, including illness, including death, we need to start that pretty soon, don't we? Because we have become used to zero, donuts, all that stuff, and it's just not sustainable.
No, that's absolutely true. We've obviously got to open up the economy. There's, 35,000 Australians trapped overseas who want to come home. But the idea of the vaccine rollout is to reduce that severe illness, and we're just not there yet. We're only at 9%. And if the issue is supply, bringing in the military to run the vaccination rollout isn't necessarily going to speed it up. So there's a bit of a quandary here.
All the meetings today were sort of saying, well, in 2 months when we get some supply, then let's do it better this time. And the PM's journey on this, in March, he said COVID can be like the flu. In May, he said COVID's not the flu because of variants, even though they'd been around for a while. And now it can be the flu again. Why the oscillation?
I don't think there's ever really been any difficulty with grasping what the next stage is and whether it's the flu or not. It's always been around trying to understand the nature of the disease. We still don't really understand a huge amount about the disease. It looks like the new varieties and mutations are less harmful than the first wave, but no one really quite knows this yet. I mean, I think,
in different studies, some suggest a little bit more, some suggest less. Let's hope it's less. But
no one's trying to dismiss the severity of catching it. Australia's going, comparatively exceptionally well. I mean, the number of deaths Australia has had to confront is far lower than some of these other countries. And the point I'd like to make is that the other countries have higher vaccination rates because they did not have the luxury of time that we did to test the vaccines. It was a very clear decision based on the views of Australians. They wanted safe vaccines. So we tested them properly, and that's actually brought us to the point where we found things with AstraZeneca that no one else knew. In other countries, they had to roll this out at breakneck speed because they had no choice.
That's true in terms of emergency approvals and starting the rollout. That's true. But if we had had the hindsight, and I don't know what happened in the room, there's all sorts of different reports, and people have the inside mail. They keep telling you that what we could have done back then at some point in time was secured the doses. We didn't have to use them straight away, because if we had more Pfizer now and over the past few months, we'd be more progressed. Surely that wasn't a deliberate design.
No, I don't think so.
Go back in time and be in August last year and get more Pfizer doses earlier, you'd do it, right?
Yeah, absolutely. And I think one of the blows to our rollout was the so-called reshoring of Pfizer from those EU countries that went back into lockdown, and their governments decided they weren't going to send the contracted doses to Australia. So
wasn't that AstraZeneca though? I don't know if any Pfizer actually got
I think
blocked.
there was Pfizer in that as well. There was both, right? So we have AstraZeneca being produced here. So that had a definite crimping effect on the rollout.
I was of the belief Pfizer had always to be delivered, but
I think we're going to be up to about 600,000 doses of Pfizer per month by the end of this month. Is it or per day?
I think more. I think it'll be. I think that might be weekly. I think we're
weekly.
2 million in 1 month and more afterwards.
It's ramping up.
Anyway, numbers everywhere. On the vaccines, when do you think the conversation turns to? It's not even altruism. We've got millions of AstraZeneca we're probably not going to use, but we're still reluctant to give it away overseas in case there's a swarm to take them up. It's not going to happen.
Look, it doesn't look likely at this point, and certainly we should be looking into giving away what we don't think we're going to use. We've got nearby neighbours like Indonesia, Papua New Guinea, others who could certainly be using it. But then I think you've got the political problem of it doesn't look good to be giving away vaccinations while people are crying out for them here as well.
Well, we can give enough away where we're going to say we've got plenty of AstraZeneca if you want it, but here are some doses that are, going to go off, for whatever better word.
Yeah, and I think you've certainly seen there's a number of young people who aren't necessarily eligible who'd be willing to take that risk, knowing and consenting to it earlier if they can, because I think now that we've had more outbreaks, New South Wales is in lockdown. A couple of months ago, the Prime Minister was saying it's not a race, now we're on a war footing. I think, the public has come with the Prime Minister on that. They do think it's more urgent.
Would he regret saying it's not a race?
I think the race comments were largely in response to people wanting the rollout to start before ATAGI and the Therapeutic Goods Administration had given the all clear rather than an emergency approval. So
but that rhetoric,
everyone wanted...
When you pull out not a race in front of the queue, I mean, if you're looking at OECD, we were not at the front of the queue for the vaccine.
No, we're not, but we're definitely at the front of the queue in terms of the way we handled the first phase. So if you wanted to be in any country in the world, bar New Zealand, you'd be in Australia for the sheer
But is
way
that a problem for the Prime Minister now? Again, people believed him, I think, when he said we're at the front of the queue, and here we are. It's very obvious to everyone that we're not. We actually lost the race sometime last year.
I don't think anyone would say that the rollout of the vaccine in what was a major logistical exercise where every government in the world was feeling its way in the dark, and there were always going to have to be tolerances given for mistakes. You can go back and quibble about language and expect an absolute 100% run in what was a global crisis. I don't think any reasonable Australian expected that of the government. I think they wanted to be as safe and as secure as possible, and the government has made it very clear that, yep, it's had to adjust to various factors like the change in advice that's come down from the TGA and ATAGI, like the reshoring of the vaccine out of Europe. You work around it and you get on with it and you keep going.
Do you have any sympathy for having to deal with the premiers as well? This 4-point plan, much derided, but getting them to agree on something where you're talking about opening up, it's difficult, isn't it?
Look, it certainly is difficult, and I think many people, the public included, have been willing to give the Prime Minister and all the premiers a lot of leeway, but I do wonder if we're starting to see that grace that the public has extended to politicians when they're all in consensus mode, we're all in this together, starting to run out.